Thank you for having me today. It is an honor and a pleasure to be a part of this Brain Turn Summer Seminar Series talk. Thank you to everyone who has put this on. Joshua, Dr. D'Amico, Lenox Hill Neurosurgery Department. Thanks for having me speak today. So today I will be sharing kind of an inside look of what it was like to be a COVID nurse at the height of the curve here in New York City. I was working at Lenox Hill Hospital. I'm still working there during the peak of the curve here. I will be sharing some personal stories, what I went through and what I experienced, the feelings and the emotions. Kind of look at it as, my diary or a book. It's more of a storytelling presentation. I hope you all enjoy listening to my very personal narrative of those few months inside of the hospital. So first, let me tell you a little bit about myself. My name is Emily Fawcett, and I've been a registered nurse at Lenox Hill Hospital for 9 years. It was the first hospital I started working at as soon as I graduated, and I fell in love with it and have not left since. I'm currently on the medical surgical telemetry float pool, and I love it. So every day I get to go to a different unit, work with different services and different types of patients. It keeps me engaged, on my toes, keeps me focused, as I'm always learning something new, and I know almost everyone in the hospital. So just to give you a little perspective on being on the float team, one day I could be on the psychiatry unit, and then the next day orthopedic unit, and then the next day down in the emergency room. So it's really, really fun to be a float nurse. Another huge part of who I am and what I do is international medical mission work. This is my true passion in life and why I think I was meant to be a nurse. I've been traveling to Nairobi, Kenya for the past 8 years. I run and coordinate free community health clinics in Kibera. Kibera is located in Nairobi, Kenya, and it is the second largest urban slum in the world. The Kibera slum is not recognized by the government, and almost 1.5 million people live in the size of Central Park. There are no public schools, there's no running water, no sewage system, and little to no access to healthcare. On average, my team of about 10 medical professionals will see and treat approximately 700 patients over about 3 days. It is a huge undertaking and project for me, as I am responsible for getting the translators, getting the medicines, getting the location, advertising for the clinic, getting the staff, but I look forward to it every time. For almost all of the patients that we see and treat, it is their only access to medical care. Other past medical missions that I've been on include a medical mission to Haiti, being aboard the USNS Comfort, in South America on a month-long mission responding to the Venezuelan migrant crisis last August, and responding with Northwell to Puerto Rico in response to Hurricane Maria. Medical missions have taught me a lot. They have taught me to be adaptable, flexible, a fast learner, and to be a leader. They have taught me to roll with the punches, to have a backup plan to your backup plan. They taught me to respect others and to treat everyone with the same kindness, and that all lives matter. Little did I know that all my past mission work would be preparing me for a future mission of a lifetime in my own backyard, in what would become the epicenter of this pandemic. The start for me was March 14th, 2020. I picked up an overtime shift in the emergency room this day. It was still eerily quiet, the calm before the storm, but something was brewing. I felt it, we felt it, without really knowing what we were feeling and without even really talking about it. I remember this day very clearly. A Saturday, COVID was just starting to sneak its way into our city. It was like an uninvited guest, but we still did not really know it was here just yet. And then bam, one of the hospital's first critically sick suspected COVID-19 patients comes through the doors. Immediately, he gets intubated and put on a ventilator. His sats were low, even on the ventilator. His chest x-ray looked horrific. It was with this patient that I learned just how scary this unknown virus is, how it can change a person's life in a second. We did not have his swab result back yet, but we knew this was the start. I just knew. My gut was telling me we would soon find ourselves in the same position as China and Italy. New York City would soon be on the news, and we would soon be the headline. I would soon find myself in my own mission in my city, New York City. March 16th, 2020, I hit the ground running. I was one of the first COVID nurses here at Lenox Hill Hospital. I was assigned to normally what is the medical ICU step-down unit, but now the COVID ICU step-down unit. The 7th floor was one of the first to become completely COVID. I saw a lot over the next few months. I felt a lot, had a lot of emotions. I saw people die alone. I saw my coworkers stricken with anxiety. I saw New York City come out and rally for us every night at 7 p.m. I saw coworkers get sick. I took care of coworkers with COVID. I saw tears. I saw one coworker watch her mother die of COVID. I saw sadness. I saw setbacks. But I also saw triumphs and love. I heard constant sirens outside. I saw the big ice truck roll up to act as our morgue overflow. I saw scared and alone patients. I saw family members begging to come visit their loved ones, for us only to tell them no, absolutely no visitors. I held the hands of the dying and tried desperately to be there during their last breath, even though I was told over and over to limit our exposure and not go into the rooms unless we needed to. Because see, now we became these patients' families. We had a strict no visitor rule, as all the hospitals in the city did. So we were the ones that had to be their families. We all stepped up into this role and took it very seriously. My heart broke for these patients and their families, and I could only imagine what they were going through and their emotions of not being able to be together. I cried with families over FaceTime. I prayed with families over FaceTime. I've never seen so many sick patients, so many short of breath, struggling to breathe. It seemed like patients were either on a non-rebreather mask or intubated, all critically sick, all requiring loads of oxygen, and many on the verge of death. Never before in my career as a nurse have I had to threaten my patients with, flip on your belly and take deep breaths, or else we may have to put a breathing tube in. I worked countless overtime shifts, 11 to be exact, in a month and a half. I heard the endless rapid responses in code blues overhead. Hearing so many codes every single day was so gut-wrenching and terrifying and put the entire hospital on edge. And I had my eye constantly on the COVID graphs and charts, and I was glued to the news briefings. I was tired, I was scared. I was imagining the peak. I was imagining what it would look like if we ran out of vents. How would we choose who got a vent? How and who would we choose to save? Would we really have to play God? I was imagining patients in the hallways and auditorium. I was imagining how could we possibly ever make it through this? I was thinking of all the lives that would be lost and all the grief-stricken families. I was living at the hospital during that time, barely sleeping. But there was no other place I wanted to be. I wanted to be there, be in the fight. I needed to be there to defend my city against this virus. One of the scariest days we had was April 1st. Talk about chaos. This day, our oxygen supply went critically low in the entire hospital because almost all of our patients were requiring supplemental oxygen. And we had many, many vented patients in-house.
Hey, Emily, I don't mean to interrupt. Is your screen advancing or are you still on in the chaos screen?
I'm still on in the chaos.
Okay, great. Just wanted to make sure. Sorry to interrupt.
Totally fine. One of the scariest days we had was April 1st. Talk about chaos. This day, our oxygen supply went critically low in the entire hospital because almost all of our patients were requiring supplemental oxygen, and we had many, many vented patients in-house. All of a sudden, there was a very loud, high-pitched alarm going off overhead. I have never heard this alarm before. None of us had ever heard this alarm before. Next thing we know, people are yelling for us to quickly get everyone on a portable oxygen tank, and vented patients needed to be manually bagged. It was chaos. How does a hospital run out of oxygen? All of these patients needed oxygen. Do you know how much time you have for a patient on a maxed out non-rebreather mask on a portable oxygen tank? 15 minutes. You have 15 minutes until your tank runs out. All 4 of my patients that day were on a non-rebreather mask. And every time I needed to switch out a tank, I just prayed I would have another full oxygen tank. But we somehow pulled through this day. We made it through this day purely because of fast thinking and teamwork. But it felt like wartime nursing. It was wartime nursing. I have many COVID stories that I find myself holding on to. Certain shifts, certain memories, certain patients. Stories I sometimes share with family and friends, but sometimes I choose to hold these stories close to my heart and keep them as mine. Do my friends and family truly understand what we went through? I figure this audience will understand them, so here are a few of my stories. My Navy vet story. I had the honor and privilege to be a part of a beautiful send-off of an actively dying Navy veteran. You might wonder how death, especially from COVID-19, could possibly be beautiful. Well, this was beautiful. We knew his time was near. We called in his family, his son, a cop on the front lines, as well as his daughter. And with the help of management, we gathered the staff, gathered a Navy vet who had been working that day. We all suited up in our PPE along with the family. Goodbyes were said. He was thanked for his service. We all saluted him. And with the Star-Spangled Banner playing in the background, he took his last breath. It was truly beautiful. He taught me that amongst all this pain and sadness and suffering, there is still beauty and love. My 5 angels story. One day I had to work on the palliative COVID unit. Yes, we had to make a palliative COVID unit. And all 5 of my patients died during my shift. It was heartbreaking for many reasons. They died alone. Families could not come and say goodbye or be with them and hold their hands. And yes, they were older, mostly nursing home patients, but nobody deserves to die like that. It was this day that I learned just how many lives will be taken because of COVID-19, how many families this will affect. I also had a total breakdown this day because I was determined that none of them should die alone. And I really wanted to be there for all of them, but I couldn't be. It was a heartbreaking day for me, and I had to be at peace that the 5 of them were in some ways together. It made the journey to the other side not alone, but together. They became the 5 angels, and they taught me it is okay to not be okay. My husband and wife's story. Remember the first critically ill COVID patient I saw come in through the emergency room that I had talked about earlier? Well, I ended up taking care of his wife for a week. While he was intubated, maxed out on pressors, extremely sick in the ICU, I had the wife on the ICU step-down floor. They were literally a hall apart from each other. I had such little hope for the husband's recovery that I even went through the lengths to get healthcare proxies made for both of them if it came down to neither of them being able to make decisions. I cried with her, prayed with her, forced her to eat and sit in the chair, brought her crossword books to distract her, even if just for a moment. And after nearly 2 long weeks, he started to improve. He was weaned off the vent, and after returning to work after a couple days off, I found them together, sitting next to each other in the same room, with plans to go home in a few days. He was the one that taught me not to give up on someone and to hold on to hope. I soon found myself on a new mission, and I was very determined. I was now on a mission to spread hope. Hope Huddles started from a late night text thread I was on with some emergency room nurses. They were telling me just how upset they were, how it seemed like there was no end in sight, how it was sick patient after sick patient, intubation after intubation, vent after vent, the anxiety, the unknown, the tears. One nurse even told me she cried for the first time in her 10 years at work. The ER staff was on the true front line. They were the ones receiving sick patient after sick patient, admitting these critically ill patients to upstairs COVID units, never knowing if they live or die, assuming most of them died. I felt a strong urge to develop a way to spread our positive patient outcomes around the hospital, especially back down to the emergency room. And so, Hope Huddles was born. A simple yet effective way to close the loop, to get the information back to the staff of our successful extubations, of our amazing patient outcomes, stories of patients waking up and FaceTiming with their loved ones, stories of patients being reunited with their families. A simple huddle of staff that took maybe 5 minutes. That was all the time we had. Sharing the good news, sharing some hope. That was all it was. But these hope huddles became our lifeline. We did not realize how desperate we all were for some good news. How desperate we needed to hear about the patients successfully coming off the vents. These hope huddles kept us going, knowing there was hope for some of these patients. It was all we needed. They gave us the fight and encouragement to just keep going, to just keep fighting for our patients. What have I learned? Well, I have learned a lot from COVID-19, as I do any mission, that we are adaptable, we are flexible, we are innovative, that we do not give up, and we will fight till the end. We created surge units in unused areas of the hospital. We deployed staff to areas that they do not normally work. We created a swabbing team. We created a system to easily obtain PPE. We created a proning team. We learned how to treat and manage this disease. The list goes on and on. My hospital came together. We were a united front, and we were able to solve most problems and obstacles that came our way. Nurses, doctors, administration, surgeons, housekeeping, management, respiratory therapists, physical therapy, nurses' aides, dietary. We were all working together like we have never done before. The collaboration was unbelievable. People were stepping up. I was stepping up. New York City was stepping up. I learned that people really do rise to the occasion. I have learned that Lenox Hill is truly like my family, my work family. I have learned that we are truly made for this, and that not even a pandemic can crush the human spirit. Now the question is, how do we move on and recover? I think the answer is we don't really. We just find our new normal. Or maybe we do. I'm just not sure. I know we're doing better. We are way, way on the other side of this curve. Our numbers are way down, almost zero. We did find the light at the end of that long, long tunnel. But we should not forget what we just went through. We should not forget the lives lost. We should not forget the bonds created with our coworkers, with our hospital, with our city. We just went to an unexpected war together against COVID-19, one that none of us signed up for. And now we are coming home from that war and have to figure out, where do we go from here? How do we heal? from what we just went through, what we just witnessed. We lived and worked through a pandemic, and we still have an ever-looming threat of a second surge. I think it's important we hold on to hope. Hope might be the only thing we have right now. Hope that we will overcome this as a country. Hope that we have changed for the better from this. Hope that this has given us some perspective on life. Hope for our future. New York will start to heal, and hospitals will start to heal. Communities will start to heal, and all of us will start to heal. And we will recover from this, hopefully stronger and for the better. Thank you again for being here today and for listening to my stories from being inside the hospital during the height of the pandemic. I hope you guys enjoyed it.
Emily, hey.
Hey.
Thank you so much for doing this.
Yes.
Sorry I missed the introduction portion.
That's
I'm actually
totally fine.
in a BLS course as we speak, so, which you have to keep your certs up. I mean, super powerful talk. You know, I have nothing but complete respect and admiration for everyone who was on the absolute front line. You know, as a department, Langer got us all involved early, but even, you know, at our busiest, it was nothing like what you guys were doing. You know, seeing the patients constantly, being in the room constantly, putting yourself at risk, putting your families at risk, and then having to deal with all the emotional kind of, you know, baggage that comes with something like this.
Mm-hmm.
I'm definitely going to open it up to the chat, but I just wanted to say, you know, as we enter into, you know, phase 4, you know, what are your thoughts? What are your reservations? How do you feel moving forward? You know, compared to the normal people who are excited to go out and, you know, grab a beer or, you know, have a cup of coffee or have dinner with their friends, you know, what do you feel about it?
You know, it's a good question. I am cautiously optimistic. I think I feel pretty safe in New York City compared to other states. I would hope that most people take this seriously and wear a mask and continue to wash hands and continue to social distance. You know, I tell my friends that I think that this is going to be the life that we will be living in for quite some time until there's a vaccine, until we know more. And we do have to start living again. We have to find a way to start living again, but safely, and do it safely, and know who you're around, know if they have sick contacts, still social distance, still wear a mask. So I think there is a way to safely start to live. And I think New York has been pretty good about it, aside from some stories I saw over the weekend about people being out. But, you know, we have to start somehow living.
Yeah, absolutely. Is there any talk as it kind of rages through the rest of the country? You know, obviously New York got a lot of people floating through. Is there any talk of anyone from New York going elsewhere? Is that something that you would look into, or are you kind of saying, you know what, I did my part. I'm gonna chill for a minute?
So good question. Northwell, you know, Northwell sent 26 of us to Puerto Rico during Hurricane Maria a couple years ago, and that's just a value of Northwell as a health system. And so I actually got an email from Northwell about a week and a half, 2 weeks ago, a survey asking for any interest of if they were to deploy some volunteers to other states that were really hurting, would we be interested? 650 of us responded that we would go. I was one of them. I think, you know, the saving grace of all this was all of the immense help, you know, from you guys being the patient liaisons, to the orthopedic surgeons being the proning team, to the traveler nurses that came on and just took that load off of us. You know, I was able to take a week off after in May after all of this craziness because of those travel nurses. And so I want to give back and help other states. So we should be hearing soon if there is a deployment in the future.
Yeah. We've got a question from one of the viewers, which echoes what my next question was going to be, which is basically like, you know, self-care, both during and now afterwards, kind of in this recovery phase, because obviously you've been through a ton. And so what did you do to take care of yourself then? What are you doing to take care of yourself now? How does it differ?
Yeah, so I mean, during the peak, I just, you know, I don't think any of us had time to process it, to think about it. It was just, I was running on anxiety and adrenaline and, you know, never know. I was just so anxious about like, what's next, what's next. So it's funny, the hardest part for me was actually coming down off of the peak, because then the adrenaline kind of leaves and the anxiety kind of leaves, and it's like, wait, COVID is leaving? So like it just, we flattened the curve so quickly that it like hit me, and I was like, oh, now I have to think about what I just saw. So that was the hardest part, was coming off of it. So, you know, Lenox Hill was really good. We set up a kind of a self-care for staff called the Lavender Team. And we had a holistic nurse, we had a priest, chaplain, art therapy. They were giving out, you know, lotions, and we could talk to them. And we created a warm line, it was called. It was a line that you could call any time of day, 24 hours, to talk to a therapist on the phone. So that was really nice. And then I took that week off, which was really important for just so I could decompress. And, you know, even that talk, just doing like writing it all out and writing some of those stories was really therapeutic for me. But it's, you know, it's a challenge to go through what we just went through, and now kind of like seeing people out drinking a beer. It's wild, but I take it, you know, a day at a time, and I honor my feelings and honor some days I don't think about what I saw, and some days I have flashbacks from what I saw, and I just try to take it day by day.
Yeah, absolutely. Absolutely. Do you want to cycle through some of these questions, see which ones appeal to you here? There's a ton coming in. It's very hard with 1,500 people.
Yeah, do you want to pick some? Let's see.
So someone said they're interested in mission trips. Can you suggest or provide some information regarding that?
Yeah, I mean, obviously right now there's not much international travel going on. I was actually supposed to run a medical mission trip in end of June, which has been canceled, unfortunately. But, you know, there's a lot of really small organizations that run medical mission trips that you could probably just Google. You know, I think there's a lot of blogs that have different organizations, and it's important to do your research and know what you're getting into and kind of do your background check on the organization. But there's a ton out there to get involved in, which is really cool.
Great.
A lot of people want to know, what do you think about schools reopening?
Oh, I don't know. I'll leave that to the professionals. You know, I'm so torn between, again, we have to start living life safely and figuring out what that looks like and what that means, because I think we're going to be in this for a while. And I do think students need, you know, in-class learning. And I really do trust, you know, the government, you know, the officials here in New York, Cuomo and de Blasio. And, you know, he said it perfectly the other day. He said he doesn't just, you know, wake up from a dream and decide to open schools or put his finger out and see where the wind is blowing. You know, they're looking at the data, they're looking at the numbers, and I trust them completely to shut things back down if they need to. So, you know, I think we just keep watching the numbers and see what happens. And if there is a way to safely reopen schools, whatever that may look like, it's not going to look like how it used to. I think it would be a good thing.
There's a few people asking about how care on the Mercy was different than at Lenox Hill, about whether or not the protocols are different, and how, you know, what did you have to adapt to the changes there?
On the comfort?
Comfort, sorry.
Yeah, so we responded to the Venezuelan migrant crisis, and we essentially went around to different South American countries that their health systems were just totally overflooded by all of these migrants, and they had no access to healthcare. So we were kind of a twofold mission. We took people on board ship to have surgeries that they really needed for many years. And then we also did on land kind of primary medical care, to say. But it was different, but also like I was in a hospital. It was very interesting. But we had to paper chart everything, which was different for me. If I gave a medication, I had to hand write it that I gave it. My orders that I received from a doctor were all handwritten out. So all of that was a little bit different, but it was also kind of the same flow. You know, the OR nurse would call me and give me a report on the patient, and then the patient would show up to my unit on the boat, and I would admit them and do my assessment and get the orders from the surgeons. So there some things were very different, but other things were just, you know, nursing is nursing at the end of the day.
Some people are wondering how you go about interacting with friends or family that doesn't want to take social distancing seriously and doesn't want to wear a mask, and how they would approach those people.
So I'm pretty lucky because most of my friends are actually scared to see me. Although I never got sick through this whole thing. I tested negative for antibodies. So my friends take it very, very seriously. We have socially distant, we had a lot of weddings planned, baby showers, bridal showers, bachelorettes, all of that was canceled. And all of us are practicing social distancing. With my family, we made the decision together that they felt comfortable with me coming home to Connecticut. But we wear masks, we wash hands. So we are taking it really seriously. If I were to encounter someone who wasn't, I would just excuse myself from them and say I'm not comfortable to be in this situation, because my friends and family are taking it so seriously.
Emily, what advice do you have for people going into medicine after this time? I think people are split. In some ways people say, I'm inspired to help. A story like yours is extremely inspiring. I want to get in there. I want to help. I put myself at risk, but it's for the greater good. And then there are other people who are saying, not for me. I'm done. No part of this, So, where do you draw kind of your strength to keep going with things like this? And what advice do you have for people who are interested in pursuing, ideas like this or careers in healthcare?
It's funny because none of us, wanted a pandemic in our careers. Maybe some people wanted one, but none of us signed up for this. And we were never asked like, hey, do you feel comfortable doing this? It just started happening. And COVID slowly took over the entire hospital. I mean, we started with one unit of COVID, and then eventually the entire hospital was COVID. And again, none of us asked to be in it. I think it's who we are as medical professionals and caretakers and healthcare professionals. We just started doing, and we just started, I didn't even think twice about, I'm putting myself at risk. I just started going in the rooms and taking care of these people. And if you're really passionate about taking care of other people, you just kind of do it. And so that was never a big issue for me or concern about my own self. Because again, I'm a nurse, I take care of others. But people that are interested, now is the best time to join healthcare, I think. We just went through something so crazy. And I think we all learned so much from this. And it was an incredible experience to be in the thick of it during it here in New York City. I would never trade my experience. And then the people that are saying, hey, not for me, well, then it might not be for you, because you never know what's going to happen. And you have to be able to roll with the punches in medicine, and you always have to put your patient first. And that's just how it is. And that's why we're nurses and doctors. We put our patients first.
Yeah, great response. You know, the neurosurgery department, we kind of felt the same way. I mean, no, we definitely didn't ask for this, right? This is an infectious disease. We have very specific rules about what we like to treat. And so, but at the same time, we're educated, we're trained, and, you know, we try to fix things. And so you're confronted with a problem that doesn't have a solution, and you've got a background education, and you just say, what resources do I have that I can offer here? And I think that's something that our department definitely did. And I think you're right. There's something in the DNA of healthcare professionals who you know, need to do this. So let's see if there's any other questions. Josh, can you handle a few for quick? I'm getting asked questions in my BLS course.
So a lot of people are liking this question here. Someone said, as a current nursing student who is about to graduate and missed out on valuable clinical time, do you have any advice on how to enter the healthcare field feeling unprepared?
Oh, honestly, don't worry. I learned everything as a nurse in my job, in orientation at Lenox Hill. You'll be totally fine. And I think, you know, we all understand that you guys are missing out on clinicals or classes or whatever. But I truly, when I started 10 years ago, everything I learned was on my 3-4 months of orientation in the hospital on the job.
That's great. People are asking, what kind of impromptu policies in the hospital were made in reaction to the COVID outbreak? Like, what specific protocols were put in place?
So the wearing the PPE kind of changed almost on a daily basis. Which masks, if we could re-wear masks, re-wear gloves, and that was just forever changing because all of the data and research was changing as well. We still don't know that much about COVID-19. So all of those policies were somewhat new. Just kind of like, it wasn't really a protocol, but who was working where. You know, the neurosurgery team took over something. We had nurses from pediatrics who were pediatric trained, and obviously we shut down our pediatric floor. So they were deployed in the hospital. So we had to kind of create a protocol of what to do with all of this staff who wasn't used to working on the floors and taking care of like critically sick medical patients. So that was really interesting to see, like they were kind of thrown into the fire. And then just kind of the informal protocol of you know, do the best you can. You know, there was just, I don't want to say there were no rules, but there were rules, but we didn't have to document like we had to. We didn't have to do full assessments. We could sign off medications late. So all of that was kind of put aside, and it was kind of like wartime nursing. And it was, you know, we were really drilled, do the best you can to save your patients. And we all kind of just followed that mentality.
Someone was wondering, how did you choose to go into nursing? What was your path like?
So my mom is a nurse. She's still a bedside nurse she's been at her hospital for 40 years. She worked COVID at her hospital in Connecticut. And so I kind of grew up with that in my family, and I was an EMT in high school. My town is run by volunteer EMTs, and it's a whole high school program. So I kind of had that exposure as a high school student. So I knew right away. So I only applied to nursing schools. So I went straight from high school into nursing school.
We've got some other good questions coming through. There's a good one about being scared day to day without having adequate PPE because of the high risk of transmission. This is something we all dealt with, but I'm curious on your take of it since you were in the room, obviously, more frequently than probably anyone else.
You know, I always had the PPE I needed. There was a time where we had to re-wear the same N95 mask we were told for a week or until it was compromised or, you know, didn't fit properly anymore. But I always had an N95 if I needed one. I always had a gown. Yes, we were running low and, you know, things were locked up and you had to go to management to get what you needed. but it wasn't that difficult. And we actually created a PPE system where I could, we wear kind of these walkie-talkies, and I could press a button and say, I need this. And in 5 minutes, a new N95 showed up. So it was never an issue. We always ended up having it. But there was a lot of anxiety, watching the daily Cuomo briefings. He would say, we have PPE till the end of the week, and then I don't know what we're going to do. Or even Lenox Hill would say, we have PPE for this amount of time, and then we don't know what we're going to do. But somehow we always got more, and it always worked out, thank goodness. So I never went into a room without the proper PPE.
Someone's wondering what was your longest shift during COVID? Because you mentioned you slept at the hospital.
So I always went home. Sleeping in terms of just always being there, but just to put things in perspective, I've been a nurse for almost 10 years now, and I had never ever done an overtime shift ever in 10 years. And so my normal shifts are 3 12 to 13-hour shifts a week. And I was doing 5 a week for almost 2 months. So I would work 5 13-hour shifts in a row. And for someone that has never done overtime, that was just crazy. But, I was getting phone calls to please come in. And there was nothing else to do during the pandemic. And, I felt like I needed to be there. It was a difference of, my coworkers having to go over ratio and taking more patients, or me being there. I always chose to be there. So I was working a lot of extra shifts those couple months.
That's incredible. That's awesome. People are wondering, did you get scared to get sick, or wondering of how your life was going to be affected, and like how that affected your feelings to go to work?
So during it, you're just in the thick of it, and I wasn't thinking that much. I was just doing, and I really wasn't scared about getting sick until my roommate, who is a nurse at NYU in the emergency room, she got sick from COVID, and she was very sick. And it was at that point I was like, shoot, are we all going to get sick? Like, we're in the rooms. We have to be in the rooms. So that was the only time that I was like, shoot, like I could get sick from this. But again, I didn't let myself think too much during all of it. I was just in the thick of it, and I was just doing. So I think protected myself a little bit mentally by just not overthinking everything.
So Emily, God forbid this comes back. The ICUs fill up again. We're all back on duty. What are you going to do different? From every aspect of it, emotionally, how would you handle it differently? Is there anything that, you would anticipate, and how would you move kind of if it were to happen again?
I think I would make sure I really took care of myself. Having some more self-care moments, whether that means, doing a face mask at night or doing a little yoga or stretching. I would really make sure I was in tune with myself. Another thing that, I think I did pretty well the first round, but the toll it took on the families that they couldn't be there was just like, I've talked to some families afterwards, and I could only imagine if that was my family on a ventilator and you can't be there. I would probably have to be arrested. I would be knocking down the doors. So just really, we're so busy during a shift. And that's why the liaisons were so vital to the day-to-day, people talking to the families, letting them know what was going on. But I would try to be there, be a little more aware of what the families are going through. Again, I knew what was happening, but I didn't necessarily have the time to talk to them every day, and I would have liked to. So just kind of being a little bit more connected to the families.
Yeah, it was obviously overwhelming in terms of time.
Yeah.
We have about 5 minutes left or so. Sorry to bring up all the PTSD of this and make you relive it. But the feedback has been really good. I think everyone listening definitely appreciate it. I appreciate your time. We're very happy to have you here. If you want to end now, or if you want to keep going a little bit, there's questions still coming through, so your call.
Let's do like 1 or 2 more questions.
Sounds good. So someone just asked, where was it? I lost it because they come in so quickly.
I know.
Someone just asked, how's your life now? Which I think we've kind of touched on already, but I think it's a good question. I mean, you look happy.
So. I mean, it's a weird time, I think, for everyone is affected by this, not just healthcare workers. I kind of explain it like life's on pause. Like I had 4 big weddings of my best friends. 2 of my friends had babies, but like none of us can see each other. So I'm finding my new normal. I'm spending half my week in New York City doing my shifts, and then the other half I'm going home to my family's house in Connecticut, just to get out of the city a little bit and have some social interaction. But life is weird for every single person, I think, and the best way I can explain it is that life's on pause right now, and we're kind of in this weird limbo, and it's important to just kind of stay on track, stay safe, and find your new normal, but do it safely.
That's great, Emily. Josh, any last questions you want to touch on?
I think she hit a lot of the important ones and hit a lot of good ones. I mean, there are a lot more in here, but you did a great job. And I think people were very inspired. The feedback was absolutely incredible when you finished talking.
Great. Thank you. I'm happy you guys, it's interesting way to do a lecture, kind of doing it in a diary type setup. So I'm happy that you all enjoyed hearing me talk about what I went through.
All right, Emily. Thanks so much.